sometimes floaters can mean that you have retinal tears or detachment. Lalo na if the floaters is associated with flashes of light. Blue filter is not really proven that it will prevent the damage.
Good day, everyone. I'm Dr. Jing, and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. This sight-saving month, I'm here with Dr. Irwin Cua, the head of the St. Luke's Medical Center Eye Institute, Quezon City, to share expert tips and recommendations for better eye health. Good day, Dr. Irwin. Thank you so much for joining us today. I'm so glad that we were able to get you despite your very busy schedule. I heard that you had a lot of procedures or patients downstairs. So thank you for indulging us with your time. So let's get straight to the point, Doc. Now, how often do you recommend adults to get their regular eye checks?
Well, for adults generally, if you're over 40 years of age, I would probably recommend maybe at least once a year, no?
At least once a year.
Oh, and then if you have others, let's say you have if you have other medical illnesses like diabetes, hypertension, maybe 6 months to 1 year.
I see. So it has to be more frequent
Yes.
if you have an issue.
Tapos if you have certain, if you're myopic, if you're nearsighted, you're farsighted, you have presbyopia, probably at least once a year you have your eyes checked.
Because we're all aging, Doc, diba?
Yes.
So we might eventually need also our eyes to be checked for farsightedness.
Yeah.
So, Doc, what do you usually do when a patient goes to you for an eye exam or an eye checkup?
So for the eye exam, first, of course, the most important part, we do a visual test, no?
Visual test.
So we do a visual test, and then we try to refract the patients. That means we try to get the grade of the patient.
The grade.
Whether they're nearsighted, farsighted, if they have astigmatism, if they need reading glasses, no? So that's the second part. We do a thorough refraction. And then we do what we call a slit lamp examination.
Okay,
So slit lamp exam, we check if the patient has any pathologies in the eye, like cataracts. And then we also check the eye pressure if they have glaucoma. And then we also check the retina. So we check the back part of the eye as well to see if there are any eye diseases. Yeah.
Because there are many parts of one eye, di ba? Yung
Yes.
what doctor is saying about the retina. Ano
Yeah.
ba yung mga, baka what you can
So
elaborate
the
a bit on
retina,
parts of the eye.
Yeah, so parts of the eye. So
parts of
the
the eye.
anterior part of the
Nasa
eye that's
harapan.
nasa harap, or the front part of the eye, that's the cornea, no? And then you have your iris, diba, yung parang black.
Yung color.
So the color is
color.
black or browns. Pag Caucasians, maybe blue or green. Tapos you have the lens.
Yes.
So the lens is parang, if you have opacity in the lens, that's what we call cataracts.
Yun.
Then the retina is the back part of the eye. So if you compare that to a camera, usually before, if you use the film camera, the retina is like the film.
Yes.
Now, today, if we use a digital camera, then probably the sensor
Is the retina.
is the retina. Parang ganun. Yeah.
So there are many parts of the eye. So Doc, any part of this structure, yung eye natin, can have an injury or damage, di ba?
Yes.
And can lead to blurring of vision or
Yes.
visual issues. In fact, cornea pa lang, surface pa lang, di ba, you can already have an abrasion. It's very common.
Yes. Corneal abrasion
no?
is quite common, no? Lalo na if you some people, if they don't wear eye protection when they do certain works,
May tumama.
and may tumatama, then you get abrasion.
What about contact lens use, Doc?
Contact lens use,
Marami
you
sa
can
tinubang
use
natin ng
contact lens, but you should be very, you should be careful in using them. Hygiene is very important, no? So you clean your lenses very well. Don't sleep with your contact lenses to prevent infection.
Kasi
Yun.
it can lead to eye issues.
Yeah,
no?
so
Simple use.
wearing of contact lens sometimes can lead to infection of the eye.
Okay, and then depending on the condition, sir, you might have to do further checks, like mga yung sa nerves around supplying the eye.
Yeah, so
it
that's
depends
part
on-
of the retina or the
The eye
retina
check.
exam. Yeah, so we
Okay.
check also the nerve of the eye if it's healthy. If it's if you have glaucomatous changes like damage from glaucoma, you can also check that with a eye examination.
Okay.
Yun.
So, Doc, what are the early warning signs wherein we should go see a doctor already, an ophthalmologist?
Well, if you have blurring of vision, then definitely
Blurring of
you
vision.
need to see a doctor, no? So an eye doctor. any eye redness, irritation, discharge, itchiness. If you see floaters, if you have flashes of light, those are some symptoms that you need to see the doctor.
So, hindi lahat ng eye redness is sore eyes, di ba, Doc?
No.
It could be so many things.
Could be a lot of things. It could be from, let's say, if you have a high eye pressure, you can have eye redness. You have more like a bacterial infection or more serious infection that could be eye redness. Yun.
Yes.
So not everything is sore eyes.
Yes, in fact, we also refer patients to you and vice versa, no? Because there are also autoimmune conditions affecting the eye and it can manifest as redness. So hindi lahat ng mapulang mata ay puyat lang, no?
So if you notice any redness, irritation, then best thing is to check with an eye doctor.
Okay. Doc, what about floaters? A lot of people complain about floaters. What could be the causes of that?
So floaters usually comes with aging.
Okay, aray
Okay,
ko. Kasi
so
may floater ako.
no, I have floaters as well. No?
Okay.
So floaters are very common. No, so it's just the jelly part of the eye. So inside the eye, there's parang a gel. So in gel, usually it's transparent. No, so you sometimes nagko-coalesce siya. Then you develop floaters.
Okay.
So floaters are very important that you don't dismiss them. No, so
don't
kasi
ignore.
Sometimes floaters can mean that you have retinal tears or detachment. Lalo na if the floaters is associated with flashes of light.
I see.
So if you have floaters tapos may flashes of light,
Check up agad.
you need
Go
to
to
check
an ophtha
agad.
immediately.
Now, if you have floaters only, you still need to have your eyes checked.
Okay.
Kasi baka that could be an early sign of maybe a retinal tear or a detachment. So if you detect those early, it's easier to treat. Yun. So floaters, but I would say probably floaters 90% of the time
is
normal.
They would be benign.
Normal.
So is it true that you have to ignore I mean, if you're sure that your ophtha already said it's nothing to worry about, do you ignore it? Yung you try daw to ignore it so your mind doesn't
Yeah, because floaters
focus on
nandiyan na sila. So sometimes you just get used to it.
Okay.
And then you try
Yun
not to
to mind it.
To mind them,
As long
yeah.
as you've made sure that it's nothing to worry
Yeah,
about with your
yes.
ophthalmologist. Doc, can we please explain to the audience what retinal detachment is? It sounds scary, you know?
Oo. Well, retinal detachment is parang there's a separation of your retina from its underlying structure, you know? So this can happen if, let's say, sometimes if you have a high grade, like you're nearsighted, your eye was longer.
Oo.
So kung longer siya, there's a higher chance that the retina can tear, mapupunit.
So if you if it's like a camera, parang matatanggal yung
film or yung sensor. So
So
para
you-
mapunit siya. So sometimes floaters can be the early sign that there's an early tear in the retina. So if you have floaters and then you know that you're nearsighted, then you need to check with an ophthalmologist immediately if you have those symptoms, especially if you also have flashes of light. So retinal detachment just means the retina is parang napupunit siya from the underlying structure.
and it can lead to blindness.
It can definitely lead to blindness. So if you detect it early, sometimes you can just do laser treatment.
Yes.
But if it's late, then you have to do surgical procedures.
I see. Doc, does family history have anything to do with eye issues? Meron bang concerns? For example, if you have anything in the family in terms of medical conditions, would it translate to a possible disease also in a son or a daughter? Or
Yeah.
in the
So
family?
the most common probably is glaucoma. No. So glaucoma is if you have a family history of glaucoma, then there's a higher chance for you to get glaucoma
And
as well.
glaucoma is if you have high pressure inside the eye.
So glaucoma is usually associated with high pressure. Sometimes it could be asymptomatic. You might not have any symptoms. So it is increased pressure of the eye because of the drainage of the fluid in the eye is compromised. So you increase the pressure of the eye, affecting your optic nerve.
Naiipit.
Naipit. Nasisira yung
nerve.
optic nerve.
Yes.
So you get damage and then yun. So if the damage is kung it's early, then you can control the damage. But if it's late, then it will be more difficult to control it. Yeah.
It can lead to blindness.
It can definitely lead to blindness.
So that's a very scary thought, no? To get blind kasi like dalawa lang yung mata natin, eh, diba? Ang hirap mabulag. It's a very important sense, no? One of our senses. Doc, so let's go to procedures. I'm sure very important ito to know, no, by our audience. Can you please explain the differences between PRK, LASIK, and SMILE eye surgeries?
So PRK, LASIK, and SMILE all are laser refractive procedures to correct your nearsightedness, farsightedness, and astigmatism, no? So we have different procedures.
Okay.
For PRK, we'll start with PRK. It's the oldest technique,
I
no?
had PRK.
Yeah, so PRK is still a good procedure. It's safe.
When I was young, it speaks of my age.
Yeah, so
Oldest
PRK
procedure.
is ideally indicated for patients with thin corneas. So if your corneas are thin, hindi pwede LASIK. Sometimes it's safer to do PRK. Now with PRK, the downside is there's discomfort after, no? After maybe you'll have discomfort 2 to 3 days. Visual recovery is a bit longer. Maybe it will take 1 week to 2 weeks before you can see 20/20 vision. So those are the downsides of PRK. For LASIK naman, it's probably the most popular laser refractive procedure. So for LASIK, the advantage is that minimal discomfort, fast visual recovery. Most of our patients, the following day, they can see 20/20 vision.
Ano nga daw siya, life-changing.
Life-changing, so may
That's
wow
what
effect siya.
Parang wow.
Yeah, so the disadvantage of LASIK is that you create a corneal flap.
Yeah, there's a flap.
So once you create that flap, you kind of damage some of the corneal nerves. So that will result into dry eyes. So in LASIK, you tend to have more dry eyes.
I see.
Yun. And then since there's a flap, probably for the first week, you have to make sure that the flap
It's not
is there. It doesn't move.
I think that's the reason why I chose the PRK then.
Yes.
Kasi I had a baby or a toddler, tas sabi ko baka masipa
Baka
yung
matamaan.
eye ko.
Yun.
So I chose
So
PRK
those
at
are
that
some
time.
of the disadvantages of LASIK, no? But generally, it's a very good procedure, no? So
Then
yun.
life-changing na talaga.
And then last is SMILE. So SMILE is it's a newer procedure, no? But we've been doing it in St. Luke's for probably more than 10 years na yan, no? So SMILE has advantages na parang there's no flap.
Okay.
It's just done through a small incision. So you have less dry eyes compared to LASIK,
And no
definitely. And then no flap. So if you accidentally rub your eyes during the first few days of the procedures, most probably nothing will happen. For SMILE, usually we don't need to advise them to wear protective goggles kasi walang flap eh. For LASIK, definitely you have to wear protective goggles for the first week. For SMILE, most of the time we tell them you don't have to wear goggles, no?
So SMILE is the latest technology or parang it's the newest.
It's the newest procedure among
procedure.
yun.
And it has probably the most pros, tama ba?
What kind of
Is there a downside to it compared to like LASIK or
Well,
PRK?
for SMILE, there's the disadvantage is that it cannot correct at this time, no?
At
this
this
time,
time.
it cannot correct farsightedness. But soon we will be able to do that.
Okay.
And then for very high grade, hindi pa rin kaya ng SMILE.
Okay,
Yeah.
so LASIK would still be
Well,
better ba? Or
probably
also-
the range is about the same.
Okay.
Yeah, so parang the same lang. So
What
for
about
very high grade, we
Grades?
have other procedures for that.
Okay, so you have ano pa po yung other procedures
So
that
we
have?
also do what we call implantable contact lenses. So we can put the contact lens inside the eye.
Inside the eye. Wow, permanent contact
Yeah,
lens.
so
parang
that's
ganun.
for very high
Very,
grade.
very high grades. Okay, I didn't know that. So I learned something new today, Doc. What factors determine which specific eye surgery is suitable for a particular patient?
Okay, so before we do the surgery, you do a very thorough screening. So siguro it will take around 2 hours. So that's the most important part. Actually, the
Pre-surgery.
procedure, the
Yes.
pre-surgery, the screening.
The
no?
screening.
So during the screening, we'll see which procedure is ideal for you and which is safest for you. No?
Which is safe is so
So,
important.
like I've mentioned kanina, if your cornea is very thin, then probably the safest will be PRK. And then, if you have dry eyes, then probably you want to stay away from LASIK we can do smile instead, no? Tapos, if you have very active lifestyle, kunyari, if you're into contact sports or things like that, then probably would recommend smile.
Okay.
Yun.
So different strokes for different folks.
Yes.
Okay. In terms of recovery, you already mentioned that it's fastest with smile
And LASIK.
and
both.
LASIK.
Yeah.
Lastly would be PRK.
Yes.
But it can serve as a specific subset of patients.
Yes.
Doc, what about corneal transplant? Do we do it already?
Yes, we do a lot of corneal transplants here in the Philippines.
Okay,
Yeah,
so-
there are certain diseases that, let's say, corneal diseases, no? Like you have corneal scar, you have diseases, congenital diseases or hereditary diseases that can affect the cornea that we need to do a corneal transplant. Now currently, the advancement in corneal surgeries is that, so yung cornea kasi it's composed of different parts. You have 5 parts in the cornea. So before, when there's a problem, yung buong cornea tinatransplant namin.
Okay.
So now, if we see that the problem is just the inner layer of the cornea, then we can just replace the inner layer.
Galing.
So that means faster recovery and then less chances of rejection.
That's nice to hear.
Yes. So
didn't
if
know
it's the
that.
front part
Galing.
only,
Just,
then we can just replace the front part. Parang ganon.
ang galing na advances in medicine.
Yeah.
Doc, in terms of lifestyle, are there any tips that you can share with our viewers if they want to ensure that their eyesight will be, continuously good?
Yeah. So usually, nowadays, no, it's more common if we use a lot of computers,
Okay.
iPad, and things like that. No, so that could
Digit.
lead to eye strain, dry eyes. So I would usually advise them, if you're using computer, you rest at least 20 minutes,
20 minutes of
and
rest.
then you look for something at a distance for something sa 20 feet for 20 seconds. That's a 20-second rule.
Okay.
So 20 seconds,
Every 20 seconds?
every 20 minutes,
Every
you
20
rest for 20 seconds, you look at something 20 feet away. This is to reduce eye strain and
Okay.
reduce dryness, no? And then other lifestyles, probably I would just recommend a healthy lifestyle, healthy diet would probably best for the nutrition of the eye.
So there's no particular diet naman, Doc? That,
No particular
Diba
diet
parang
naman, basta healthy dapat.
when we were growing up, kumain ka ng
Carrots,
carrots,
no.
kumain ka
Yeah,
ng
so
okay naman.
those are healthy food, so
Okay.
it will definitely benefit your eye.
eyesight.
Yes.
Okay. So, hindi naman siya yung if we eat carrots, hindi na tayo magkakaproblema sa mata.
No, it doesn't.
Okay. Going back to screen time, you mentioned screen time. It's really something that we all deal with nowadays. Aside from looking away for a few seconds, is there anything else that we can do to help with, prevention of strain? Totoo ba, Doc, yung mga blue glass, ano ba yung tawag?
Well,
Totoo ba
yeah,
yung
the
mga
blue filter. Blue filter is
that-
not, hindi siya, it's not proven.
It's not yet proven.
Yeah,
to-
so there's no, ano pa lang ngayon, no? It's not really proven that it will prevent the damage.
Okay.
So wala siya. So actually, you don't really need the blue filter at this time.
Okay, so I think I see that a lot on social media.
Yeah.
Yung they're selling glasses with blue filter or something.
Well, if it makes you more
Supposedly,
comfortable, okay lang. But there's no actual evidence showing that it will
it's
cause
still
less
more
damage.
important to take breaks
Yes.
when we are using our gadgets.
Also, if you have, if you feel that your eyes are dry, usually kasi kung sa computer ng long periods of time, you get dry eyes, no? So you need to put some lubricating drops.
Or else you could have corneal aberration nga ba?
Well, you get irritation.
Irritation.
Parang you feel that they're uncomfortable, so you get dryness. Or sometimes the epithelium or the skin of the eye is a bit loose. It's not really adherent to
Nakadikit,
the
underlying
structure, no? So madali siya magasgas, in other words.
Very painful
Yeah,
condition.
so very painful. In those cases, we actually advise them to put some lubricating gel. And then if you have if you have blurring of vision, redness, or anything, floaters, then definitely you need to have your eyes checked. If you have family history of, let's say, glaucoma, and of course macular degeneration is also hereditary, no? So if you have family history of those diseases, then probably do regular eye checkup.
Regular eye check.
Yeah.
So, very important ang vision, no?
Yes.
Takot ako mabulag. Thank you so much, Dr. Irwin, for such a wonderful afternoon sharing your expertise
Okay, thank
on
you.
how we can take care of your eyes, of our eyes. And so, thank you for joining us on MD in Focus. This is Dr. Jing. And remember, your health is your greatest wealth. Always consult a health specialist for more reliable health information. Remember to click the follow button, and until next time, stay well.